Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals across the country. And today we have an expert who's going to answer your questions and queries in the live session. And on this show, you also can win discount vouchers and also gift coupons. I'm going to ask you three simple questions. There's going to be a health quiz where you can win prizes from Apollo 24/7. I urge you all to download Apollo 24/7, which brings the entire Apollo hospitals to your mobile phone. So just by accessing one app, you can have services, you can access services from Apollo hospitals. So I urge you to download Apollo 24/7 app. And today we are going to talk about something which is very, very important for our existence. We're going to talk about memory. So how to improve your memory as you age. This is going to be the topic for today. And today I have the privilege of having one of our senior consultant neurologists from Apollo Hospitals, Chennai, Dr. A.C.Somasundaram on the show. And he has 15 years plus experience, and he's a member in American Academy of Neurology since 2014, member in Indian Academy of Neurology since 2014, Indian Epilepsy Association, life member, and he's an Association of Physicians of India and Movement Disorder Society of India as well. He's received gold medal in pediatrics, and he's a university medalist in neurology, and he can be consulted for headache, stroke, epilepsy, and Parkinsonism, dementia, insomnia, and all other neurological disorders as well. So it's my honor to welcome Dr. A.C. Somasundaram ji onto the show. Good morning, doctor. Welcome.
Namaste, namaste. A very good morning and very happy Sunday to everyone joining in. And
Thank you. Great to have you on a Sunday morning, sir. We understand how difficult, especially in the medical profession, one can be really stressed. But you have taken this time out. It means a lot to us. Thank you, and we appreciate it.
The pleasure is all mine.
Thank you, doctor. So, Dr. Garu, let me just jump into the topic. And by the way, let me tell my audience that this episode is going to be predominantly in English. Last week, हमने हिंदी में episode किया था, but this episode predominantly is going to be in English. But Dr. A.C. Somasundaram ji can speak Tamil and a bit of Telugu as well. In case you require an answer specifically in the languages mentioned, please go ahead and say. And अगर आपको हिंदी में डॉक्टर साहब ने जो समझाया उसको ट्रांसलेशन चाहिए, I can do the job for you. And doctor also speaks a bit of Hindi. So let's continue, doctor. And our audience are going to ask us questions on YouTube chat. They're watching this on Instagram, Facebook, and all other social networks. But any questions, my dear audience, please bring them on to YouTube chat. Dr. A.C. Somasundaram will be answering your questions very shortly. So, Dr. Sir, let me start off with one basic question. What is memory and why is it important for our existence?
Yeah, memory is a basic function of the brain. We have to understand that many patients used to ask me, is there a specific structure in the brain which is responsible for memory? It is not. The brain is somewhat like a computer, but it is not like a computer in all the aspects. Like in a computer, if you see, there is a hard disk, there is a random access memory. There are specific areas in a computer where you say that the memory comes from. But when it comes to brain, I cannot leave a single part and say that is completely not related to memory. Almost every part of the brain you should take care. So how to preserve memory as you age can be translated into how to preserve your brain function as you age as well, because brain function and memory are intricately connected. And certain facts are very important. Does everyone lose memory as they age? Yeah, obviously, there is. As long as you have an expiry date written on your head, your memory is also going to have an expiry date. You will lose memory as you age. But is it an inevitability? Are you going to definitely lose your memory as you age? The answer is definitely a big no. We have hope of having a very good. I have several of my colleagues who themselves are octogenarians, nonagenarians. You cannot say that they have memory loss at all. They are still.
No, doctor. I have my father who was like mid-octogenarian who recently has left this world. On his, just before 2 days before, he could mention specific details while he was in his delirium. Also, he could deliver bits and pieces of information which were very, very prominent. So I'll not say that everybody who's aging will have memory issues, but then does age have some kind of role to play? Bachpan maybe children do have such certain kind of memory issues while they're learning. Youngsters have problem recollecting names and And also adults have problem ki, where did I put this thing? And seniors do. So age, does it have any certain aspect of memory loss myth?
Yeah, as you progress, your memory tends to go down. But the earlier ages also, like as I told you about octogenarians and nonagenarians still having an intact memory. And at the other end of the spectrum is seeing some teenagers and 20-year-olds complaining with memory loss, coming to OP with memory loss. And many times it is quite like what they mean as memory loss is quite a misunderstood term. That is what I say. Like it could be some sort of an anxiety that is underlying the problems, or it could be an underlying, like one thing you have to understand is as long as memory involves two things, it is like registration and recall. First of all, you have to
Ah,
register things properly in your brain and then try to recall it. Like you cannot just skim through things and try to expect, and our expectation should also be nominal. Like you cannot like
yeah.
just
You,
learn a
you
page
can't
in
have,
5 seconds.
it should be rational. Yeah,
Yeah.
you can't have expectations beyond what your capacity is.
Yes, yes, yes. So the registration part in many cases of memory loss that I see, usually that the registration itself is not, especially in the younger age group who are pushed to their limits, in say appearing for a competitive exam or something, their memory is pushed to their limits. So the registration, they just skim through a sentence or a skim through a topic, and they expect to recollect it even before the registration is complete. So I want to emphasize that memory is not only recall; it is also about registration. You cannot expect
Wow.
to play back a song from a CD player if you haven't recorded anything on it.
Amazing answer, doctor. Thank you so much. And that is so, so, so bang on pointed. Registration and recall. So, what have you registered, and that's what you're going to recall.
Mhm.
So what are the factors that will influence? How do I can I exercise something like, are there any tips to make sure that I'm registering well? And is there a problem when I say that I'm not able to recall names? So is it the problem with the registration, or is there a problem specifically with recall only?
No, one thing is I will not put everything on registration alone, because if you see the different types of memory loss, what we call as the medical jargon is amnesia. And that in that the most common type of amnesia is what we call as an anomic aphasia, anomia. What that is the most common type of memory loss that we see. Anomia means like failing to recollect names. That is one of the most common forms of anomia. So I will not say that everybody who forgets names or some items from a list. I will not say that everybody has a registration problem. Some could be the early signs of developing dementia. Whenever a patient develops dementia, the earliest thing they lose is the ability to recollect names. That is the first thing to go in case of dementia, and that is the last thing to recover. The ability to
Wonderful.
recollect names is a difficult thing for the brain to do. So almost all the circuits are tested to their optimal limit. So the first thing to go in case of any sort of dementia, the first thing will be anomia, that is loss of ability to recollect names. So what are the ways we can recollect names or things better? Like there is something called as a memory castle. You can just Google and see. Like I don't want to take too much time explaining about the way of recollecting things. They are
Yeah,
freely
we can put
available
it on the chat box as well. Our team can put it in the chat box.
yeah, what
So
is
it's
a
called the
memory
mem-
house? What is a memory house? What is a memory palace? You can just imagine as if you are walking through a palace. Through the entrance, there is a picture of a bird there. If you want to recollect a sequence of events, there are strategies we can do that. There are strategies by which you can improve your memory. And one more thing, as I said, registration is far more important. Take it slowly. Whatever you want to remember, just take some time and to register these things properly. And a good sleep will
okay.
also help.
Yes, doctor. Yes. So Rakshak AR was asking about memory and age of the brain. Is there a correlation, especially in kids? So do kids also have to follow this kind of strategy of registration, walking through slowly, or do they have a different capacity?
No, kids actually, my personal opinion is that a kid should not be hindered in its development. Like the kid knows what it wants, and the most important thing about kids is keeping them mentally active. Like it is very very important, especially in a developing brain. Like the kids don't only need food, more than food, the kids need information. They'll be craving for information. You see a toddler, he'll be asking 1,000 questions in a single minute.
Huh?
So that like not answering him and not giving that him or her the enough information is almost what I feel as a neurologist is akin to starving them. So it is very important that kids get the proper nourishment, information nourishment, what they need to learn. And this is where I feel that we have lost the plot a little bit as Indians. Like we used to live with our grandparents and parents, generations together. A kid on a single day will have to interact with almost 20 or 30 people. And they used to have
Ah,
lot of things developing during that time. Now, this nuclear family thing that we are following from the Western culture is this is partly to blame for the elders developing dementia because like the relationship between a grandparent and a child is a mutually beneficial relationship. Let it be the
absolutely.
parent or
So
the
it's
child or the
helping each
grandparent.
other.
Yes,
Very, very
the
well
child
said.
gets a lot of wisdom from an octogenarian or a nonagenarian. 80 years of wisdom, the kid gets to enjoy that at the age of 3 years. And the octogenarians are forced to think and keep themselves active so that they don't fall into slip into dementia. So it is a mutually beneficial relationship. I strongly encourage people to do that. Increase the number of interaction that your child has to your parents and your grandparents and your relatives more and more. More and more the information that you feed your kid, the more and more stronger mentally the kid becomes.
నాకు మీరు ఈ మాట చెప్తుంటే గుండె ఆనందంతో ఒక్కసారి అలా పొంగిందనమాట. చాలా చాలా సంతోషంగా అనిపించింది. బికాస్ ఇట్స్ నాట్ జస్ట్ ఫర్ కల్చరల్ బెనిఫిట్స్ దట్ వీఆర్ టాకింగ్ అబౌట్ టు హ్యావ్ ద ఫ్యామిలీ సిస్టమ్ intact. It's more about how healthy and how happy that you can function with everybody in your family. Wonderfully said, Doctor. So next question I would want to take up is, do Maya's question on YouTube, how does low B12 levels affect memory? And at this point, I think we'll also talk about how certain supplements or vitamins are known to be memory boosters. What are good, what are not good? So first with Maya's question,
So
B12 low levels, yes.
that's a very good question, Maya. Like B12 deficiency is one of the major factors of memory loss, definitely. But definitely B12 supplements are required. And like wh- just coming to this question, like I want to say a healthy diet is very important. Like not only B12, like our mind is what we eat. That is what some people say. Like what we put in our stomach definitely goes to the brain as well. So if you put in some junk food there, obviously your brain thinks of some junk things, and obviously you put a very healthy food there, your brain will think of healthy things. It is as simple as that because the blood that your brain receives directly comes from the gut, the nutrients that your brain receives. So
Right.
eat a very healthy food if you want to think properly, if you want to have a good memory, a good mental health as well as physical health. Everybody knows that physical health depends on what you put in, but mental health also is equally, if not more, dependent on what you eat. It's like I will suggest you to take a very healthy diet, more and more of green leafy vegetables, and more and more of grains, nuts. Like for example, a lot of antioxidant containing foods like citrus fruits and oranges, gooseberries, avocados. And more of a plant-based diet is what I will recommend. And you can take a bit of a non-vegetarian food as well. Maybe fish, which has a lot of omega-3 fatty acids, and that in some studies that there is evidence that they also are very much important. Omega-3 fatty acids are also important when it comes to memory. But
Yes.
my
So here,
suggestion is, I think,
yeah, Maya has
yes,
put in that her B12 levels are 100, so which is actually
ma'am.
low. So in case somebody is detected with low B12 levels, so वो तो diet से can they be able to, will they be able to correct it only through
No,
diet?
if they have clinical deficiency, if they have a lab proven deficiency or clinical deficiency, the best thing to do is get it corrected through oral supplements, B12
Medication.
supplement, B12 tablets are there. A lot of things are there in the market. If you have a condition which prevents your body from getting B12, there are some of my patients I know who take gunny bags of vitamin B12. Still, the B12 is low. They have a basic
Ah,
defect in their stomach lining, which prevents them from
absorption.
getting access to the
Right. Right,
So for
right.
these patients, we have to rely on some injections, monthly injections every month, so that it is a parenteral way of we are trying to bypass the intestine and delivering B12 directly to the blood and the brain. So I won't suggest that to everyone. Like that being said, that is being overused by some patients. As soon as you get a vitamin B12 deficiency in your cards, you go and get ask for the doctor for an injection. Injection is always
Oh,
better to avoid as long as there is no other way to inject that into your blood.
wonderful. So the next question is Mr. Devashish Mukherjee, here 69-year-old male. I have a problem with recent memory, but I remember what has happened 40 years ago. So this is what I've seen a lot of elderly group complains about. They have their childhood memories intact, but they have trouble recalling immediate things. Is this a problem, doctor?
No, the thing is, we have to first of all understand how memory as a function of the brain functions. We have to understand what is memory to answer this question. Like there is something known as a Ribot, named after a scientist, neuroscientist, Ribot's law. What that says is the things which you have learned earlier in your life are the ones which are very difficult to get rid of. Like the memory which you have formed during your childhood days stays with you for a longer time. It takes a lot of damage to the brain to get that off your brain. So that stays with you, and whatever you learned yesterday or maybe an hour from now doesn't stay with you. A small insult like just banging your head somewhere will make you forget these things. These synapses are just very young. They're like let us put this in a like when it comes to older memory, it is like a big banyan tree. You need a lot of force to fell that tree. But a new memory is like a germinating seed. You blow something on that, it just falls away. It wilts away. The reason is that there is something known as consolidation. There is a process by which the short-term memory is converted into long-term memory that requires years to form, and that requires a lot of recollection. And that is what, and we selectively think that our recent memory is worse than the remote memory, but that isn't the case. It is more of what we call as a survivorship bias. Do you
Okay.
remember what did you wear on a particular day 25 years ago? 25 years ago, nobody can do that. But we expect that to be remembered now. Just because yesterday I forgot what I remembered, that doesn't mean that my recent memory is far worse than what I was earlier. Huh? So obviously, yes, as you age, you tend to forget a lot, but there is a bias there as well. That is why remote memory is far more resilient to damage compared to recent memory. One is because of the survivorship bias, and second thing is because of how the brain functions, consolidation functions, according to
Well,
Peter and Report.
here I will pitch in. I will bulldoze you to give me some tips to say, okay, मेरा recent memory I may not able to register it well. So are there any exercises or are there any tips from your side so that I can do? No, for me, repetitive measures helped me for a bit. So if I go through something repetitively, that makes me confident about that I can remember this. Is this a way, or yeah, Rattamar is not a good type?
No, what? Yeah. In a way, that memory for you to remember things which are important, the best thing to do is recollect them often. Just
Okay.
recollecting them over, and what we call as revision. Like memory is like a filing cabinet. You remember like there is a big room. There are some billion drawers in which each drawer has a billion rows, and each row has a billion pages in them. If you want to recollect the way you can lose that, all that is stored in your brain. I'm not just exaggerating things. You have a billion drawers in your brain right now. You have a billion drawers, billion columns and rows of billion pages each drawer has. You have that in your brain. uh, the first way you can lose your memory is like if something happens to the drawers and if the physical pages get destroyed by themselves, or you can also lose your memory if you forget where you placed a particular memory in your brain. Like that is the reason why you should keep recollecting where for example, if I say that get this particular information from this entire heap of information that is there in your brain, it is very difficult for you to answer. If you very difficult for you to answer. But if I say from the column 3 of book number 72, 77, the page, it is easier for you to answer. So you should remember where you have stored that information. So what I'm trying to say is that you should keep recollecting. You should keep taking things from the drawer which is important, and just keeping them back again. Just take them out, see them once, keep it back inside your brain. So that is the power of recollection. So that becomes more and more, that there comes your power of consolidation. So whatever you want to remember, keep recollecting it. Keep it every day if you want to, or maybe more than it doesn't hurt recollecting more often. Than there is no overdose of recollection. So how much ever you
Okay.
want to recollect things, try to keep recalling them and putting them back.
Okay. So now for children, doctor, I know not many have asked for children's memory issues. So, there's a way that people say that, you can engage in activities, as you've said, information, give them information and they will process. So, what kind of activities should children engage in and do rhymes and giving them in poems, songs? Do they help them,
Definitely,
teaching
poems,
theirs?
rhymes are specifically they are built for the children to understand words. There is something known as verbal memory. There are two sides of the brain, the left side and right side. So what these songs do is that they stimulate the right side of the brain, and the verbal memory is residing on the left side. The songs
Ah,
force your kids to the memories, the songs, the rhymes, the intonations that you use during songs. They help to your kids to learn words better. That is the basic reason why rhymes were invented in the first place. The rhymes were invented
okay.
because our people, whether our ancestors had the knowledge of the right side of the brain or left side of the brain, I'm not too sure. But
Right.
it also increases the real estate for your brain to process. You also involve the right side. I have a pa- I, it is I have a patient who has complete memory loss. Who has complete She doesn't understand. She doesn't even recollect her name. But once I asked her to sing, she sang for 30 minutes, not missing a single word. And So that is something which is for us to understand. We have to use the right side. For that also is a memory tip. If you want to remember something, make it as a song, and that song itself, that right side will itself kick the information out of the left side. So you can use, because the verbal memory, as you said, naming, it relies exclusively on the left side, whereas the right side is just staying idle. Whereas you give that information as a song to a child, the child will be able to remember it even better, because now she is using two sides of the brain for remembering.
Right. So here's a question from an office goer who's working. 34-year-old mother male has difficulty in recalling recent conversations and misplaces objects frequently. In these scenarios, working people who are in office and अगर conversations भूल जाते हैं, if that's a problem, it's going to affect their personal, the skills or workplace. It's going to be affected very badly. So why does this happen? What are the factors that one has to check?
So, like, if this happens to you, like most of the patients who have come with from the middle age or working age population who come to memory loss from me, almost 90 to 95% of them, I will say they are either one of the two. Usually they are expecting like unimaginably lot of things out of their brain. Their expectations are out of line. That is one of the major reasons. Like, that is what the society does to us. It keeps pushing us more and more. Whatever you do is not enough, especially in a competitive environment or things like that. And ultimately, you pass the blame onto your brain. My memory is faltering, things like that. So I will ask you to take a step back. Just take a step back, breathe in, and just take things slowly as they come. I don't want you to just rush through things, because there is no point in reading 100 pages and not remembering a single page, rather than reading just a single page which is important and remembering it. So that sort of thing that you have to, like, don't push too much. Don't be like, anxiety is one of the major factors for memory loss. There have been studies which have proven that anxiety and going through your everyday routine, obviously it is very difficult. Even I'm anxious a lot of my times, even though it is easier said than done. Take a step back, breathe in, breathe out. What things you need to remember, store it properly in the brain. First of all, store it properly. Make sure that you put in things for you to take it back later. And take a step back, maybe do some meditation or something, and take things slowly. And definitely they are good. And obviously, the previous things I told, a good diet, a good sleep. Obviously, sleep is a very big important factor when you want to recall things well. And many students who come to me, they come and say that I read 24 hours a day. The students who
Ah,
prepare for exams, that is humanly impossible. They think
yes,
that it is
yes.
possible. If you because 2/3 of your time, if you gather information, 1/3 of the time you need that time to go and place those files in proper cabinets and for you to
Process
remember
this.
them. So that is very
Yeah.
important. There is no point in just pushing yourself 24 hours a day and then expecting nothing is coming out because you have not filed anything. It is everything is just a mess. There is no,
So
everything
before
the
I
files are not. Yes.
Yeah, Upendra Prakash ji ka question लेने से पहले to add to this question to the examinations and then people preparing 24 hours, I've
Hmm.
seen students struggling 23 hours, 22 hours, giving
Hmm.
stimulants like coffee,
Hmm.
they're awake, coffee and tea, and also people
Hmm.
who are stressed at work. I can see the caffeinated beverages that which are, they are
Hmm.
also with all these so-called Chinese herbs ke saath ginseng, taurine, L-taurine,
Hmm.
and they
Hmm.
sound so good. Do they
Hmm.
really help you? Do they boost your, do they keep you up?
No, during my early years of medicine, during my MBBS years, I used to be a caffeine. I used to take a lot of caffeine. I used to drink some 10 or 12 cups a day just before preparing for exams, and I soon realized that they are not giving any. That is one of the reasons why I got interested in neurology. Like you take more and more caffeine, and you study a lot. You just like I will swear for sure that I tried my best to recollect things, and I tried my best to store things properly after taking a shot of caffeine every hour or every 2 hours once whenever I was preparing for exams. But I in the end, I whatever I studied during that particular time did not come out at all. Then only I
Ah,
realized how caffeine works. I went into detailed research of how caffeine works. The day I remember, the day I read how caffeine works, that was the day I took my last coffee and tea
oh
because it
my
is just
God.
a way for you it is just a way for your brain to get fooled that your brain is still receptive to information. It is just fooling your brain. There are like a disclaimer, there are several pathways through which caffeine acts, but the major pathway that how caffeine promotes wakefulness is it makes your brain forget that it is tired. So that is what
Oh,
happens.
oh,
Just imagine a brain like a big machine in which there is a red alarm which will blare whenever the machine is getting overheated. That red alarm was put there for a reason to prevent damage to the machine by from overheating, and it may catch fire or it may lose everything. What caffeine does is the major action. As I told as a disclaimer, caffeine has several major pathways of action, but this is one of the major pathways. How it promotes wakefulness, it just goes and cuts the alarm off. That's what
okay.
all caffeine does. So you push your brain beyond its limits, and the brain does not know that it is getting pushed beyond the limits because there is no red alarm now. There is no red light that is going to blare now because that has been effectively cut off by caffeine, and these chemicals have disabled the alarm. And you expect the machine to perform at optimal capacity when it is already overheated. Your brain is trying to tell that go and sleep. I am getting damaged. All caffeine does is preventing that information from your own brain realizing it. So it not only affects your memory, and it can lead to your brain pushing beyond what it is capable of, and it may lead to
So,
a long-term damage.
Doctor, I'm smiling because I find myself there. I'm not addicted to caffeine. I don't drink too much of coffee. But whatever, is there a permission of drinking 2 cups of coffee a day, or is that also bad to memory?
That is okay. That is okay. To eat like drink coffee in moderation. Like maybe and one more thing, since sleep is very important with memory, I will advise everyone who's listening in, don't take any stimulants after 4 p.m. in the evening. It will definitely affect your
Oh,
sleep. And sleeping is when you are
yes.
going to organize all the things in proper cabinets for you to recollect later, or else it will just be lying there as a mess, as a heap of mess of no. There will be a heap of information mess in your brain, not organized, nothing.
Yeah.
There will be no consolidation. You cannot recollect anything that you have learned during that day. So beyond 4 p.m., don't take any stimulant, coffee, let it be coffee, tea, or even chocolate. Some forms of chocolate also can cause a lot of mental stimulation, keep you artificially awake. They can keep you artificially awake when your brain really wants to sleep and consolidate things, your brain tells you it is time. Just go to sleep. I want to file all the folders in the cabinet. You keep on adding more and more stuff, and that is not how because the brain is already brimming. It is filled up to brim. It has enough work in the night. The brain wants to tell you that go to sleep so that I have some filing work to do. But you keep still keeping adding more and more. It just overflows and comes out.
Wonderful, doctor. Thank you so much. So I will keep my coffee in check and I'll use these tips of after 4, no stimulants. Thank you. So next is Bhupendra Prakashi, who's asking a very, very, very important question about anxiety. And I would also want to add stress to the question. He's 54-year-old male and he's been taking anxiety medicine for the last 6 months. He's suffering from forgetfulness and brain fog in recalling names and details. So let's talk about how anxiety and stress can have an effect on memory.
Yeah, stress and anxiety both can cause functional as well as physical damage to the brain. Like it has been proven beyond any doubt now. Like what stress and anxiety does is your brain tries to go to survival mode. Like it just wants to survive the day. It just want to survive the day to fight another day. That is what stress and anxiety does to you. It makes you feel as if it pushes your brain to a doomsday scenario. Obviously, the what the brain preserves during a stressful situation is it just preserves all the bodily functions, like which are vital for living to fight another day.
Yeah.
Like it'll keep your heart intact. It'll divert all the nutrients to areas which are important in keeping you alive that day. And obviously, memory is something which you can lose to stay that alive that day. That is what the brain does. It switches off areas in the brain which are required for higher cortical activities like attention, concentration, and memory, which unfortunately is the way we survive in the corporate world now. We rely more on the neocortex. We don't rely more on our heart rate and our basic respiratory function. That is what the brain directs the blood and nutrients to whenever you are stressed out. And physically what the what happens is stress produces a lot of cortisol in the body, endogenous steroids. A long-term exposure of the memory structures in the brain to steroids have been shown to produce irreparable damage to the memory structures in the brain, hippocampus, mammillary bodies. They tend to be a lot people who have been stressed for a long time. If you look at their the physical structure of the brain, something as something as simple as anxiety can cause some permanent structural changes in your brain. As it has been proven beyond doubt, their mammillary bodies, their hippocampus are all they all tend to shrink, which are very important
The same
in consolidating.
depression as well, doctor? Is this the same thing applies
Depression
to
also,
depression?
depression, anxiety, almost always patients tend to have overlapping depression and anxiety. So depression
Yeah.
also
Thank
definitely
you for
has a role in memory loss.
Okay, done. So, doctor, so if you can treat the depression, anxiety, or panic and stress in the ways that they have to, will that help people regain their memory?
Definitely. Patients who have anxiety and depression, definitely you have to get your diagnosis confirmed from your from a qualified person first of all, because every other patient I see, they themselves say that I
Yeah,
have depression and anxiety. That is not the right way to go. So just
that's
get yourself
it's not
tested.
like
There is something known as there is
simple.
something known as a physiological depression. There is something known as a pathological depression. For example, I lose my loved one, I'll be depressed.
Mm,
It'll be
yes.
abnormal
So,
only if I
sir,
laugh after losing my loved one. So
not
that is
trying to
physiological.
lighten the situation, but you got to check if you are depressed clinically. So
Mm,
please go
mm,
ahead and take professional help. That's what
mm,
doctors been trying
mm,
to
mm.
tell you all.
And
So,
obviously,
sir,
you have
Govind
to
is
take once you're diagnosed with
yeah.
depression or anxiety, you have to take by the proper qualified professional. You have to take medications. Proper medications are very important,
Yes, just
but
if
don't
Banu is taking
self-diagnose.
medications. Now the question was
Yes.
posed by Mr. Banu. So Banu is
Mm.
under medication. Can he find his
Mm.
memory back in a certain period of time? His forgetfulness, is
Definitely,
this a
definitely.
part of recovery?
Yeah, definitely. Depression has to be tackled. Depression has to be tackled. At least if you may be able to regain memory, but untreated depression can make it even worse. So that is far more important for you to realize.
Valid point, doctor. So, Mr. Govinda Soumya Narayanan's question. He is in a high stress job, 58-year-old, and is it? Am I forgetful? And some months I forget what I think few minutes back. quite worried about it. Age is 58. Is this a symptom of any disease? Well, age, memory loss, we've been talking about it. Now, quickly, any
Mhm.
tips that you want to give for people who are stressed and high stressed working environments?
Like what I will suggest for people who work in high stress environments, like you if you are able to change your job to a lesser stress environment, that will be best. But if it is not possible, what I will say is that spend more and more time with your family. Like social interactions will also, it has double effect. One thing is it
Mm.
reduces your stress level once you go come home and spend time with your family. Go for a vacation once every now and then, maybe once in 2 months, 3 months. Take a break from your job. Try to bring your brain back to normalcy. And once these things, once the stress, like you have to find ways to handle your stress, the outlets for
Yes.
stress. And if it is possible to change your job to a lesser stress, obviously take it. That is the first advice. That is the first suggestion that I'll give you. If it is not possible, try to spend more, whatever time you are spending away from your home. Just don't try to go into social media. Try to don't whatever time you have left with your family. I don't want you to waste it on what we call as a doom scrolling, going through some lot of doom messages in WhatsApp or something like that. This is there, war in there, war here. Just shut off everything, spend more time with your family, handle your stress better. That will definitely help with your memory.
Wonderful. Right, sir. So, COVID is something that I would want to take. Anshul had problems with COVID, and due to COVID, he has a lot of issues. Let me find Anshul's question. Where did it go? So, while okay, in the scroll, I could not. Yes, he has brain fog and neuroinflammation due to COVID. And in my PET scan, there is a mild diffuse hypometabolism. He's 27-year old, and a lot of details that he's added. But doctor, are there only certain population who are affected by this kind of issues, or has COVID-19 in general affected us in memory and brain fog?
See, like regarding COVID is something new. Like I know I started knowing more about COVID only in the past 3 years. Like we used
Correct.
to know that there is something known as coronavirus, SARS. Previously there was SARS and things like that. And right now we are beginning to understand what COVID can do. We have just 3 years of data in comparison to centuries of data that we have compared to other illnesses. We are trying to realize that yes, there is a link between COVID and dementia. There is a link between COVID and memory loss, but I wouldn't be too giving too much importance to that, because that can change. Because we all we have is the COVID is very young. The
Yeah.
data is not sufficient to attribute everything to your COVID.
Yeah. Right. So, but COVID and social isolations, and especially children of the COVID era, their memory, because learning and information processing has been very different from what you and I have
Yes,
experienced.
yes, social isolation during the lockdown times, definitely they had an impact with memory. I had an upsurge of patients who came with memory loss, depression, stress, anxiety, when they were locked down, when they were locked inside their houses. As that re-emphasizes the importance of social interactions. Man is a social animal. Without those, social interaction is one of the major ways of which you can avoid memory loss. Like when you take the most severe form of memory loss, Alzheimer's disease, what does the literature say? Social interactions is what they recommend. Social interaction has been clinically proven. It has been proven beyond doubt to have a significant positive effect on the brain, even in patients who have Alzheimer's disease, one of the most severe forms of memory loss. Social interactions and things like gardening with your family, going and gardening. Gardening is a proven, is a published, proven positive protective factor against Alzheimer's disease and dementias. Learning a new language as you get older. Make it a point that every decade you learn a new language. I think that will also improve your cognitive reserve. That is something which needs a detailed discussion. I don't want to go deep into cognitive reserve. Yes.
One quick, sir. So, language, learning something new, or is it going to be only a new language? Learning a new skill or a new language? What is it, sir?
Learning a new skill will definitely help you keep your brain curious, learn new things every day. That will keep your brain active, keep your memory active, keep your cognition as a whole active. So learning a language is a published thing. It is there, like it is there as a proven factor which fights even against that delays the onset of Alzheimer's disease. Even if you have the genes for Alzheimer's, they say that learning a new language definitely postpones it. It is there as a
I-
published fact.
Right. So I've just put up learn your language. So I've just written
Yes.
that. Learn a new
Just make it a
language on
point
my
that you
list.
learn everything. Every decade, you try to learn a new language, like maybe a decade once.
Wonderful.
That improves your cognitive reserve. That makes your brain more resilient to outside
Yes,
factors
doctor.
which can lead to memory loss.
Yeah. So a few more quick questions because I'm reaching towards the end of the discussion. Manjunath says he's addicted to alcohol and nowadays he's not able to grasp a single thing. What can I do?
Obviously, like when we talked about coffee and tea, that means that alcohol. We don't need to talk about alcohol, smoking, and tobacco. We don't
Yes,
need
and
to
you know
talk
the
about
major
that.
reason. Once you just cut off the alcohol, you'll be fine.
Just try to bring it down gradually. If you are not able to bring, like, I wouldn't suggest you to stop right away. Like, don't stop it immediately because you will get withdrawal, because
Yeah, yeah.
they all make your brain physically dependent on them as well. I've seen patients listening to somebody and stopping it suddenly and developing seizure and getting admitted to the ICU. So what I will say is that you try to tone it down, but definitely take a proper effort. Don't say that this doctor told me not to stop alcohol suddenly, that is why I'm continuing. Don't try to put the blame on me. But you have to. I think if you are not able to tone it down yourself, you will definitely need professional help. Your brain, mind, and your body will thank you for that.
Done. So, doctor, now a very complicated but a very important thing. Pratap Reddy Gavinola is asking 57-year-old diabetic and hypertensive for more than 20 years. Is there a link and relation between memory loss and other related diseases like hypertension and diabetes? Also, Pradeep Kumar, who's 25, is asking about type 1 diabetes and memory problems. So, one quick brief answer there, doctor.
Yes, షుగర్ బీపీ కంట్రోల్ చాలా ముఖ్యం అండి. చాలా చాలా ముఖ్యం. బీపీ సరిగ్గా చూసి మీ బీపీ సరిగ్గా ఉందా అని మళ్ళీ మళ్ళీ చూసుకోవాలి డాక్టర్ దగ్గర వెళ్లి. ఎన్ని ఎన్ని రోజుల తర్వాత రామా అని చెప్తారో ఆ టైంలో కరెక్ట్‌గా రావాలి. కరెక్ట్‌గా వచ్చి మీరు బీపీ, షుగర్ కంట్రోల్ చాలా ముఖ్యం. బీపీ, షుగర్ కంట్రోల్ మీరే చెప్పకూడదు. అప్పుడు ఎప్పుడు డాక్టర్ రామా అని చెప్తారో అప్పుడెళ్లి ఏ టెస్ట్ చేయాలి చూసి, ఏమంటే మీరు షుగర్ చూడటానికి రాండమ్ బ్లడ్ షుగర్ చాలా మంది చెక్ చేసి దే ఫూల్ దెమ్‌సెల్వ్స్ థింకింగ్ దట్ their sugar is under control. There is something known as HbA1c, which we healthcare professionals know. Sometimes patient, what they tend to do is they check their sugar whenever they want to. Whenever they have not consumed anything, they check it. It comes back as normal, and they fool themselves that their sugar is
No,
normal.
it's like you're
So that is
cheating
why,
yourself. You're not cheating the doctor, you're cheating yourself.
no, that cheating. That the problem is that the patient themselves don't know that they're cheating. They don't do it intentionally. Like once you are preparing
Right.
for a blood check, the mind involuntarily switches off a lot of things, a lot of your cravings,
Yeah.
and you just check your random blood sugar. I've seen patients who have random blood sugar of 100, whereas their HbA1c is 12.2 or 13 or something like that. So don't
Oh,
fool
oh.
yourself thinking your BP and sugar are under control. Get a professional help. It should be managed professionally. BP and sugar,
So
you have to
it
take
does
the
have a
medication.
link to memory, doctor? So your
Definitely,
uncontrolled
definitely.
diabetes and hypertension.
Yes, it is beyond doubt that memory is can be translated into the health of the brain. The health of the brain will definitely be taking a big hit if your sugar and BP are not under control. Not only sugar and BP, sugar, BP, heart diseases, previous history of stroke, thyroid, all these impact your memory and any other endocrine dysfunction. If you have Addison's or Cushing's or some things like that, whatever chronic cancer and whatever tumor or any other chronic ailments you have, definitely which can affect your brain, will definitely affect your memory. There is no doubt about it.
Ah, wow.
Please get everything
So
under control.
you control whatever's happening physically, physiologically, and then
Mm,
your memory will
mm,
be in good shape. That's what.
mm, mm, mm.
Right. Doctor, quick question again. Simran is a NEET aspirant, and how do I increase my memory, and how do I how do I keep the things in a long memory?
Yeah, the thing like as I already told, you need a very good sleep. That is very very basic that you have to understand. Don't push yourself beyond that 16-hour limit. The brain needs one third of
Right.
its time sleep. That is very important. 16 hours you study, please 8 hours you make sure that, and especially that 6 hours, that 8 hours should be in the night. You cannot say that I sleep from 3 a.m. to 11 a.m. So I
Afternoon.
had a good
Yeah.
sleep. No, that doesn't work. 10 p.m. to 6 a.m. is the ideal sleep time. Please make sure you sleep during that time and take good food and don't just run through things. Don't be just like, keep yourself toned down. Talk to yourself, keep yourself toned down, go slowly. Rome, as they say, Rome cannot be won in a single day or something like that. So it takes time. Whatever you want to recollect, just do it slowly, gradually. Slow and steady wins the race. The tortoise always wins, the hare loses.
Yes. So here's Arsalan, 22-year-old. Sir, does excessive screen time worsen memory? Is it proven? And this is my favorite question. I see parents giving gadgets and parents thinking that they are able to give their children information or stimulate their brains through screen and the social media, of course. What kind of role does it play in our memory?
No, it is quite unfortunate to see a lot of parents using their phones and computers as their substitutes as they go and go on with their daily activities. They expect these phones and laptops and tablets or whatnot to keep your kid engaged. So that is not how your kid's brain should develop. Yeah, there are positives and there are negatives about social media. As I said, social interactions do strengthen your memory in some ways, but too much of anything is not good. Like there should be a proper, like if you're allowing your kids to use electronic gadgets, I wouldn't go to the extent of saying that just take it away from them, because they are the generation which have been born with an iPad. They have they are born along with an iPad. We should not take that privilege from them. But be always careful what they go into, because you can do anything to the internet. There are websites even which go to the extent of how to build a bomb and things like that. That you don't want to your child to get exposed to that. So make sure that your
Yeah.
child and has a maybe restrict the screen time. Maybe let's say 1 hour a day, and that 1 hour should be that you should use the iPhone or iPad as an enhancement of your time with them, not as a substitute. You be with them, just look at what they are looking into your phone or your iPhone, and just guide them to the proper. You have to catch their hands and guide them through the digital world, which is fraught with danger.
Yes. Right, absolutely, sir. So, while we're talking about social media or other, so we now are so dependent on digital formats. I want to say that I used to have a huge phone number database in my memory. कि किसी का घर का नंबर, किसी को ऑफिस का नंबर, सब याद रहता था. But suddenly, after the digital advancements and technology has come, is this beneficial? In a way, yes, it is. But I have lost the capacity of storing details. So, how do I strike a balance between them?
No, one thing you have to this question I get from a lot of patients. They think that since you are not able to recollect your the phone numbers like as good as your grandmother or great grandmother, it doesn't mean that your memory is dipping. That I will definitely say no. That is not how you portray social media and digital advancements. Like whenever your brain has an easier way of doing something, it does that. Once you have a phone in your hand and it stores all the number, why should your brain struggle with that? So that is how your
Oh,
brain advances. It uses the real estate that it has to do something better.
right.
What our grandmother and grandfather could not, because they need to store that particular information in that particular part of the brain. Obviously, that means that they could not do something which could have been done with that real estate that they had in their head. So now we are using it for some other purpose, obviously. So please don't think that recollecting the numbers is the only way your memory functions. Memory can function a lot of other ways. You know a lot of you can process a lot more information now. You are becoming leaner and meaner.
Right. So make sure that you're using whatever time that you got to something else. जैसे डॉक्टर साहब ने बताया
Yes.
कि make sure that you're learning a new skill, new language, which is or anything that.
Yeah,
Right.
just
So
because you don't remember the numbers properly, which is being taken care of your phone, that doesn't mean that your memory is poorer than your previous generations, because your
yeah.
brain has found something better to do.
Done. So, a very important question somebody is asking here. Is there a difference between Alzheimer's and dementia? And how can one help if people are diagnosed with
Yeah,
this specific
dementia is
condition?
like an umbrella term. Dementia is like an umbrella term. It includes a lot of types of dementia. Alzheimer's is one of the most common types of dementia. Dementia with Lewy body, Parkinson's disease dementia. Lots of dementias are there. So Alzheimer's and like Alzheimer's is part of dementia, but all dementias are not Alzheimer's disease.
Acha,
So
acha.
Alzheimer's disease is a type of dementia. That is an
So
easier
how
way to
can
put
we
it.
help? Early diagnosis, will that help with their progression of dementia, or is there a regular pattern to help
No,
people with Alzheimer's?
if your parents or if your loved ones have dementia, if they have Alzheimer's disease, like I get a lot of patients who are very anxious. They want to know whether they have Alzheimer's disease, and this
Right.
is a dilemma. Like the what I will say is that don't panic. Like if you're like it is not a disease with 100% penetrance. It is not a genetic disorder which means that once you have the genes in you, you will get dementia. It is not something like that. So I will advise you not to go too much into researching whether you have that gene or not, whether you be
Yeah.
affected.
Yeah.
Uh, Even if you don't have the gene, you can be far worse off. Even if you don't have the gene, if your
Hmm.
grandparents are having dementia or something, you can be far worse off if you take alcohol and smoke and things like that. So things try to what we call as modifiable and non-modifiable things. What God has given to you through your genes, just live with it. But what can you modify? Even if you don't have
Yeah.
Alzheimer's genes, I will not advise you to go and like go for nighttime clubbing and or spoil your
Yes.
nighttime
Yes.
sleep, drink a lot of alcohol. So whatever is best for your brain, please keep doing, irrespective of whether you have a family history of Alzheimer's or whether you are afraid that you have Alzheimer's. And one thing you have to understand is even for Alzheimer's disease, the early stages, you cannot start any medication for them. The same
Okay.
applies to those patients also. If you are going to develop Alzheimer's in the future, the treatment is already what we have already discussed. There is no miracle cure which is going to prevent you from developing Alzheimer's later. But all the things which we have told right now, good sleep, good food, being mentally active,
Yeah.
engaging time with your children, controlling your stress, depression, and avoiding coffee, tea, and stimulants, and obviously avoiding coffee, alcohol, tobacco. And these are applicable even for patients. We are going to delay the development of clinical dementia in patients who are going to be who are destined to develop dementia. Or they may even prevent the
Yeah.
dementia.
Yes. Dr. Dipankar ji is asking this question: is there something called a short-term memory loss, and will that be recovered?
Yeah, as I said, like a short-term memory is like an earlier stage. It is like a germinating seed of what is going to become a banyan tree. Long-term memory is like a banyan tree. It takes time to grow. It depends on repeated recall of short-term memory. There are different types of memory when it comes to the brain. One is called as an immediate recall. You just listen to some phone number, just dial it with your in your phone. That is immediate recall. It is there. Just there is an area in the brain known as auditory cortex. So what this immediate recall is you just store information here and take it immediately out. So it doesn't go to other parts of the brain where it needs to be stored or something like that. The other a little bit more permanent form of memory is a short term memory, and the far more permanent form of memory is long term memory. It's like memory is like a spectrum. We cannot, like, even though we call as short term memory, long term memory, and immediate recall to long term memory is like a spectrum. The more towards this side you are more likely to forget, the more towards the banyan tree, the more you are we will be able to retain it.
Right. So, Dr. Chabraji is asking this question: what kind of memory exists in our subconscious mind? So, anything, or is there a specific thing that it stores?
Yeah, memory is subconscious. Like, one thing we have to understand is you know a lot of things now, but are you thinking about it now? You know you have billions of bytes or megabytes of information in your brain now, but you're not aware of it. You know where you live now. Once I say where you lived, you remember that comes back to consciousness. Memory is more of a subconscious storage, and we can take whatever we want as our consciousness wants at that particular time. So subconscious
Yeah.
memory is another form of explaining how the memory is stored in the brain, what we call as the limbic system and hippocampus. And these structures are more of subconscious. They don't come pop up into consciousness until you want some of the information that is stored in to come out.
Right. So, Doctor, one quick thing, and I would want to take leave from you. So, understanding that we need to have good food and good sleep and have good social interactions, these were the key pillars that you were saying. Now, exercise is something, physical exercise, does it have any direct connection to how good your memory is?
Definitely, like all other organs in the body, exercise is very important for your brain to have a good blood flow, because blood is through which your brain gets all its nutrients. Anything which improves the blood flow, definitely exercise is going to help your blood flow to the brain. Definitely, exercise is very important. If you cannot have, if you don't find time to go to a gym and do some exercise or something, walk more. I think walking maybe half an hour in the morning, half an hour in the evening, or walking to your workplace if it is nearby. I think that is the least you can do to keep your blood flow to the brain proper.
Yeah. And one last question is 46-year-old male Chidambaram, what are the best supplements to help reverse memory loss and boost brain power? Are there any?
No, food is very important. As I said, food is very important. What you put in your gut is what your brain is going to receive. So I wouldn't try to stress too much on some foods which are memory boosters, things like that. Let me get it clear, get this straight. There are no FDA approved memory boosters like other than a few medications that are available. So just don't go too much into that. Don't focus, because we will shift our focus away from what really matters. So there, obviously, good food is very important for your memory, but that doesn't mean that you have to go behind some food fads or something, some dieting, which there is no particular diet which will help your memory. But that being said, your diet is very important to preserve whatever memory you have. You don't eat junk, eat more and more of vegetables. That is applicable to every organ in the body, not specific for the brain.
Great. Thank you so much, Dr. A.C. Somasundaram ji. And now it's time for you to give us top tips.
So the top tips are like the first and foremost thing for you to have a good memory is, I always begin with sleep. Sleep is such a wonderful thing that God has given us. Make sure that you give that time to your body, at least one third of your time. 8 hours per day should be the sleep. Second thing is eat 3 times daily, good food. It should be more, plenty of vegetables, plenty of water, stay hydrated, and avoid stimulants, coffee and tea as much as possible. Drinking 0 cups of coffee is far better than drinking 2 cups, but drinking 2 cups is far better than drinking 12 cups. So try to reduce it as much as possible. Even if you don't drink any coffee, it is not going to affect any memory. If your memory, it is going to in fact improve your memory. And obviously, alcohol, smoking, tobacco, it is better. It is not worth mentioning. These things are absolutely harmful for your brain. Improve your social interactions. Spend more time with your family, and try to reduce your stress levels. Try to reduce your anxiety, and try to learn new things. Keep staying curious. A curious mind is something which is very difficult for memory loss to enter into. Have a very curious brain. Try to learn new things. Try to learn new things away from your field as well, and that's it.
Yes. Thank you, Doctor. Pleasure having you on the show. You were very, very
Thank you.
informative. Namaskar.
Thank you
Thank you.
so much. Thank you.
Thank you. And that's Dr. A.C. Somasundaram, who gave us tips to improve our memory. And here's your time to answer my questions. Health quiz coming up. I'm going to ask you 3 questions. Hop on to YouTube chat, type your answers in the YouTube chat, and you can be the winner for this week. And winner's name will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And if you are the winner for this week, if I announce your name to be the winner, please write back to us with all your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. आज के 3 questions screen पर. First question, fill in the blanks. Anything that impacts thinking, learning or recalling can impact what? M से शुरू होता है. M space M E. Sorry, I gave you a cue there. So what is it? It starts with M. Question number 2 is yes or no में answer कीजिए. A song, a poem, a joke may help you to remember a specific piece of information. A song, a poem, a joke may help you to remember a specific piece of information. Yes or no? Question number 3, the last one. True or false में answer कीजिए. Too much alcohol can lead to confusion and memory loss. Is that true or false? These are the 3 questions for today. And now I take the time to give away gift coupons. Let's proceed with the gift coupons, which you can use on Apollo 24/7 app. Download the app and then use the coupons on the app. Consult top doctors direct from Apollo and get 150 rupees cash back on online doctor consultation. The code that you want to use is AskDoc150, ASKDOC 150. And the next one that we are giving you today is First 3, FIRST 3. You get up to 25% off on online medicine orders. This is valid on the first 3 medicine orders above 1,000 rupees. And you get to our delivery window, and directly from Apollo 24/7, you get medicines at your doorstep. Next one is exclusively for our Health Hour viewers. Use the code HH247 and get 199 off on online consultations with Apollo doctors, and 20% off on medicine orders as well. This is in addition to the coupons that you can use. This is exclusively for our Health Hour viewers. Well, next week we are going to, by the way, you can use Apollo 24/7's WhatsApp number as well to order medicines or book lab tests. They're just a call or text away on WhatsApp 9355 247 247 to avail healthcare services. Download Apollo 24/7 and save this number on WhatsApp as well. Well, next week our topic, काफी interesting here, ear pain. You know, this is one pain that you cannot imagine how troublesome it can get, especially in children, young adults and seniors. We need to understand what is ear pain and what can you do, how emergency is it, and what are the relief options that you have at home, all that you need to know about it. Next Sunday's topic is this, and 1st of October, 11 a.m., we shall meet you. And this week's winners, here are your names. Gurbani Shabad Kirtan, Sridhar Neelkantan, and Revati Gandhi Rajan. Gandhi Rajan, okay. Sridhar Neelkantan, Revati, and Gurbani Shabad Kirtan, you are the winners. Please write back with all your details at marketing@apollo247.com. Thank you all of you for joining us and asking your questions. Your questions are very important because you spread information to a lot of people who do not ask questions. Do join us every week and do ask your questions. Thank you so much. Looking forward to see you next week. Namaskar.